All right, what is going on, everybody? Today we're going to be talking about Alzheimer's disease. So, Alzheimer's disease is characterized by a progressive memory loss, decreased brain function. It is the most common form of dementia in older adults. And what you're typically going to find in dementia, or specifically in Alzheimer's disease, is abnormal protein deposits that build up in the brain. And so we understand that in losing those neural connections in the hippocampus, of course, you're going to start to find some symptoms of people with Alzheimer's disease who are struggling with memory. Here is a little bit of a closer look at some of the things that are happening. There's going to be atrophy of the cerebral cortex. This basically means, again, that this is a weakening of what's happening in the brain. And that is what's affecting memory, higher level thinking, functioning in the hippocampus and the cerebral cortex as a result of that brain atrophy. In terms of the exact cause of Alzheimer's disease, that is still not typically fully understood. But again, we just know that it's a combination of genetic, environmental, and lifestyle factors. That's why a lot of doctors are always going to encourage their patients to exercise consistently, to sleep consistently, get consistent hours of sleep throughout their lifetime. We also know that definitely some severe mood and behavior changes to a point many family members may not even recognize the person that's before them. Typically, the best way to diagnose, there's a lot of different things that you can do. So neuropsychologist could actually see some symptoms of dementia and Alzheimer's disease. In fact, when I was working at a neuropsychological site, we did a lot of testing for dementia. And pretty much what we're doing is that we're testing cognitive ability, and we're taking that data and we're comparing it to people who definitely have already been diagnosed with dementia or Alzheimer's disease in the past. So we're pretty much taking their scores, we're comparing it to what we know is definitely going to be patients who have Alzheimer's disease. And if these patients are scoring below the range or the typical scale set for their specific age, that is a really big indicator that something is going on, especially if they previously took a neuropsychological exam maybe a year ago or 5 years ago. You can compare the differences and you can probably see some of the big differences in terms of that cognitive exam. People can also go through brain imaging, some other cognitive tests, neurological exams, medical histories. Those are all going to be different situations to figure out what exactly is going on in terms of a diagnosis. So medications, right now, there is no medication that can cure Alzheimer's disease. The medications that are available can only improve symptoms, typically maybe for 3 to 5 years. And so if we're talking about medications, then what you're going to want to have in some of these medications is something that can really improve some cognitive symptoms. Cholinesterase. So cholinesterase inhibitors are typically some of the go-tos in terms of Alzheimer's disease treatment. You also have something called memantine, which helps to regulate the activity of glutamate. It's also another neurotransmitter involved in learning and memory. So think about some of the most prominent neurotransmitters that are affected by Alzheimer's disease. One of them is going to be glutamate, and the other one is going to be acetylcholine. And so any medication that can increase acetylcholine and decrease glutamate is going to hopefully have a positive effect for Alzheimer's disease. Again, any patients that you encounter in your practicum sites and so forth, you're most likely going to refer them. You might do a neuropsychological battery, but you're going to refer them to their medical provider to make that a firm diagnosis as well as the medication treatment. Typically, psychologists are not going to prescribe medications for those patients. And so there's always going to be a consult with a psychiatrist or a medical professional. Now, as a clinician or as a psychologist, what you might be able to do is you might be able to perhaps give some counseling or some treatment to the family and to the friends in terms of giving them some coping mechanisms and coping tools to help them with what they're experiencing, and also perhaps lay out some different strategies to also help the patient that is also experiencing the loss and transition of their mental capacity. And so there are definitely some things that therapists, psychologists, mental health professionals can do in this situation But just understand that from a holistic perspective, as much as you can do, probably the best form of treatment is going to be preventative care in terms of educating patients in their 20s, 30s, 40s to continue to exercise, to sleep well, to eat well. Those are definitely going to be very strong protective mechanisms for future diseases, future potential diseases like Alzheimer's disease.